So, welcome to Shilpa Dave's Health and welcome to the walkthrough on the Functional DX blood testing platform. We're at the homepage of Functional DX, and Functional DX is a blood testing platform. Blood tells a story. From mild inflammation to chronic disease and serious diseases, getting to the root cause of our patients' health concerns starts with Functional DX blood testing. It's the world's most advanced blood interpretation technology. When we see patients for a functional medicine or platinum health screen, we provide them with a pre-appointment questionnaire that is extremely detailed, going through all aspects of their life, their expectations, their hopes, and their healthcare goals. As well as routine medical questions, we start to look at stressors, or triggers as we call them, both within diet, allergies, but also within lifestyle in general, related to exercise, sleep, and stress. The partner to that is our Functional DX blood testing. It's revolutionizing the way blood testing works and how we analyze and interpret blood testing, and is particularly relevant for functional medicine, where we're trying to look at a whole person approach to the root causes of disease. The tests you can see here are systems based and also relate to male and female health, and we think about cardiovascular and cognitive health, fertility health, male and female health. Let's click on one of them and have a little look at what we're looking at within these blood tests. So if we look at the female health testing, there are a variety of tests available. If we click on one, let's click on the Fem Ultra. You can see here that as well as the routine blood tests, which are for biochemistry and kidney function and electrolytes, we start to get things around hormones, precursors of hormones, as well as the actual hormones themselves. We also measure the things that bind hormones. The hormones are carried around by different binding proteins, and this is really, really important because a deficiency in the precursors, or the things that bind other chemicals in your body, can affect their absolute levels and function. And in addition to that, we look at really detailed cardiovascular risk factors, kidney and liver factors, and your trace elements, which are really important fuels and building blocks for all of your other body systems. When you put all of these things together into a intricative and algorithmically driven result, you start to get patterns and trends that might give ideas of future risk as well as current risk. So let's have a little look at a report. If we look at a snapshot report, we get a very detailed report which we discuss and interpret before giving to patients. And it's about optimizing your health, not just getting normal blood test results. The functional health report is really, really detailed and comprehensive, and is broken down into the body systems such as blood sugar regulation, immune function, cardiovascular risk, bone health, but also it moves on to where you may have deficiencies that need attention. And this is about grouping things together into things that make a difference to you. For example, having a magnesium replacement requirement, or drawing your attention to increased cardiovascular risk in general, or drawing your attention to the fact that you may have adrenal insufficiency, which might explain chronic fatigue. If you've got more oxidative stress on your body, which can weaken your body's systems and increase risks of cancer, whether you've got leaky gut syndrome, which is linked to your intolerances to foods, these are the really important things that come out of the Functional DX blood testing. And then they go on to talk about actual potential future risks, a so-called window into the future, which is really, really cool because you want to know if you're at future risk of inflammation of the gastric area, leaky gut, or a pre-diabetes syndrome, whether you're likely to develop underactive thyroid, even if you haven't got it yet. That sort of level of predictive and system-based analysis really allows us, together with our nutritional therapist, acupuncture and yoga, and other wellness practitioners, work with Shilpa and her team to design a tailor-made support and healthcare package for you that helps you to feel good and get well, and addresses the root causes of your problems, not just reaching for the prescription pad. There may, of course, be glaring results from here that require immediate medication or replacement, and of course the purpose of any health screen is to really exclude serious things like cancer, and those things are part and parcel of our Platinum Health Screen. But the functional DX testing is really, really clever and is very personalized to you, and is the most detailed and comprehensive system available. If you look here at the analysis, it starts to get into a dashboard where we look to optimize certain things rather than just know that they're normal. And many patients, for example, with B12 deficiency will know that they need injections more frequently than their GP might recommend based on how they feel. Similarly with vitamin D, you can be vitamin D in the normal range but be really quite deficient for you. And so this concept of optimizing your health is really, really important. By looking at all of these detailed deviations from normal, you can then bring those together with the patient's symptoms and design a really tailor-made package for your health. I hope that's given you a snapshot of what to